Hey, this is Dr. Zain Hakeem with RiverRock Medical Clinic. I wanted to talk about a couple of ideas I've had lately on the subject of sleep. Sleep is a struggle for a lot of people, and oftentimes a very frustrating thing if you don't get enough of it. And so we've got a lot of things going on that you hear, different stories about how to get better sleep, and I wanted to kind of dispel some myths and then point to some benefits. First of all, I wanted to review real quick the different stages of sleep. There are 4 basic different stages of sleep: stage 1, 2, and 3, and then REM sleep. Stage 1 is very light sleep. As you're just drifting off, stage 2 starts to be a little bit deeper, and stage 3 is a really deep restorative sleep where a lot of the hormone regulation goes on for appetite, weight loss. And then REM sleep is where your brain takes care of its own memories and sets in connections, and then forgets a lot of the stuff that is not important from the day. I always think of stage 3 sleep as the brain taking care of the body, and REM sleep as the brain taking care of itself. As you can see here, the basic different functions in all the different stages of sleep. And then I want to review really quickly this slide of a normal sleep architecture. And we say architecture because normal sleep has a pattern. As you can see, it goes up and down. You naturally go into deeper and lighter stages, and REM sleep is thrown in at different points as well. But the key to focus on is that it has a regular pattern. There's a smooth up and down motion and a normal pattern. Contrast this to a poor sleep architecture where the rhythmicity or the cadence of sleep is lost, and it's a little more hectic, it's a little more chaotic, and you don't get that natural up and down motion. It can even be broken, as you see several points along here, where it actually ends up in waking you up. One of the things I want to emphasize about sleep is that good sleep is actually a natural phenomenon. And so usually, in order to promote good sleep, you usually just have to get out of the way and sort of get the blockades out of the way, and good sleep will happen naturally. It's not something that has to be forced, but in our somewhat artificial and unnatural world, achieving natural processes can sometimes be a little difficult, and we'll talk about that as we go on. Before addressing any kind of sleep problem, the issue is there really a problem? And a lot of writing has been done about how you absolutely need 8 hours of sleep all the time, and I'm not 100% sure that's true. There is literature going back to the 16th century, before the invention of electricity, that references times when there would be what's called a first sleep and a second sleep. People would just wake up around midnight, the entire family would have a meal, and then everyone would go back to bed. It's also, in that sleep cycle, quite natural to take a nap or two during the day for a few minutes. That's not always possible in our society, and so for social reasons, we've started to emphasize getting a continuous set of sleep at night and then being awake all day. That may not be the truly natural cycle. And so if you wake up at night and then you end up going back to sleep, it's not always a problem. Similarly, the 8-hour concept, while it is true for most people, there are people who function with less. There are people who absolutely need 9 or 12 hours of sleep. And that's sometimes a struggle with today's social requirements of jobs and so on and so forth. But the key to knowing whether you have a problem is ultimately whether you're able to function. So if you find yourself drifting off very quickly, especially in the car or even the passenger seat, if you are out like a light, or when you lay down at night and the minute your head hits the pillow, you fall asleep, that's actually a sign that you're a little bit sleep deficient. Good sleep should take a natural period of time progressing down through stage 1 to stage 2 to stage 3 sleep, and should take a significant period of time between 15, 30, even 45 minutes for you to truly fall asleep. And a lot of the marketing from the drug companies and all these different drug medicines is actually just treating people's anxiety about how slow they're falling asleep, when really that's normal. It's normal to take a certain period of time to fall asleep. So what kinds of things get in the way of falling asleep? Well, my prototype example is alcohol. Alcohol can make you sleepy and sort of knock you out, but the quality of sleep is actually destroyed. So even though you're sleeping, you are in this kind of a random sleep architecture that doesn't result in good periods of stage 3 sleep where you get the restoration and the vitality and healing of deep stage 3 sleep. Most of the common medications on the market ultimately act on the same chemical receptor in the body as alcohol. That includes benzodiazepines like Ativan, Valium. It includes Ambien, it includes Sonata, Lunesta, all of the above. And so no matter what the marketing hype is about they're not benzodiazepines or they're not this or they're not that, at the end of the day, they're working the same way in the body and they have the same effect. For instance, Ambien did a study saying that it does not have the same sleep architecture changes as alcohol, but that was one study in 9 people on one night. That was not a study that was done over a period of time to see what happened in people that take Ambien every night. And in fact, the studies that were done on people taking Ambien every day or every night showed that after 2 to 5 weeks, there was no difference versus placebo, except that people had withdrawal reactions. So all the drug companies done is giving you an addiction without actually giving you any proof. Secondly, even during the 2 to 5 weeks that there was a difference versus placebo, the only difference was that people fell asleep faster. And on average, they fell asleep about 15 minutes faster. No noticeable difference in the amount of time spent asleep, no difference in the perceived level of restfulness of the sleep, no change in the function during the day or the sleepiness during the day. The only change was the amount of time it took to fall asleep. And that's a disturbing thing for a medicine that ultimately becomes addicting and then stops working. And all of these medicines follow ultimately the same pattern. The primary symptom of withdrawal from any of those medications is, guess what? Insomnia, not being able to fall asleep. So the company's giving you a medication that helps you fall asleep, except it stops working after 2 weeks. And then if you stop taking it, you can't fall asleep. So what can you do to improve your own sleep? What kinds of things? If not medication, then what? Well, number one, of course, is exercise. And in head-to-head studies, exercise actually did just as well as any of the sleep medication. So exercise 3, 5, even 7 days a week if you need to, though if you're going 7 days a week, you might not want to go as hard as if you're taking breaks in between. 3 days a week really should be enough to get your body into a cycle of fatigue by the end of the day that allows you to rest naturally. The issue there is that most people are stressed at the end of the day and they've put forward so much mental energy into their jobs that the idea of putting out physical energy in addition is just exhausting. And yet, that really is the best way to get to a normal sleep pattern. Other things you can do include not eating within an hour of going to sleep and not using digital devices within 2 hours of going to sleep. And that includes iPods, iPads, iPhones, TV screens, laptop screens. And the reason is that all of those screens produce a large amount of blue light. And blue light actually suppresses the hormone that tells your body that it's time to go to sleep. And so the best way to regulate that is, number one, get a large amount of bright daylight for at least an hour a day during the day, so that your eyes get a large influx of bright light, suppress that sleep hormone during the day, and then at night, try to switch to redder lights and get rid of the laptop, TV type of light influx so that your melatonin hormone naturally starts to build up and you start to fall asleep. Other behaviors that can help is simple conditioning. The example I always give is if you're going on a long trip and you know there's not going to be a bathroom around and you go to the restroom and you stand there or sit down, what's going to happen? You're going to pee. And the reason is your brain knows that there's only one thing that happens in this location at this time, and it will make that thing happen. Similarly, you want your bed to program you for sleep. When you lie down, you start to get into a cycle where you naturally start to fall asleep and nothing else is in the way. So no reading in bed, no watching TV in bed, listening to music, doing other things in bed other than sleep and sex. That's basically what the bed is for. And if you're doing anything else, it should be done outside of bed. Similarly, even if you're lying there and you can't fall asleep, if it's taking you more than an hour to fall asleep, you need to get up, get out of bed, go somewhere else, do something else until you're tired and you start falling asleep. Similarly, if you are up and around and you're finally feeling tired, even if it's late, you need to wake up at the same time every morning, and that includes weekends. If you're really having a sleep problem, you need to get your body onto a very set, rigorous schedule that doesn't take holidays, doesn't change on weekends. You wake up at whatever time you need to wake up, 7 a.m., 9 a.m., 5 a.m., every day, so that your body knows that's when it's waking up, so that it knows how to program when it's time to fall asleep. Other issues include, of course, stress and anxiety that keep people up when your brain's running 90 miles a minute, and you need to really take a time to calm down. There are cognitive behavioral treatment therapy techniques to help you deal with anxiety related specifically to sleep. And general stress reduction, including meditation, mindfulness, or again, exercise, can help with dealing with those kinds of stressors that interfere with your sleep. Of course, caffeine intake and the timing of your caffeine intake is important. Most adults take between 5 and 7 hours to get rid of whatever caffeine they take in. Some people take longer, some people take less, but if you're noticing that if you're having trouble falling asleep, you need to back off the timing of your last dose of caffeine. So instead of drinking coffee at 2 p.m., it needs to be noon, or instead of noon, it needs to be 10 a.m. And then you really need to switch to a non-caffeinated beverage, like a hot green tea or flavored water, something like that. The last thing that actually can affect sleep, and this is just some new sort of emerging research, is actually your core body temperature. So a lot of the things that are recommended, like a hot bath, certainly help relax you, help loosen your muscles, but it's actually the evaporation of the water when you get out of the shower or out of the bath that helps cool off your body and achieve a lower core body temperature. If your body temperature does not go down appropriately, which is a significant number of degrees, 2 or 3 degrees Fahrenheit, you actually will not achieve the same levels of deep stage 3 sleep. And so there are products on the market like Glycom, which is a very high dose of amino acids, that seem to decrease your core body temperature when you're sleeping and thus lead to better stage 3 sleep. But things you can do, like taking a warm shower or just removing a layer of covering or allowing your hands and feet to remain outside the covering so that you are able to radiate off your body heat and your body is able to naturally adjust your temperature downward, can be very helpful. If you absolutely feel that you need some sort of medical treatment or prescription medication to help you sleep, there are choices that are better than others. For instance, gabapentin has actually been shown to improve stage 3 sleep rather than decrease it. Or some of the other antidepressants like trazodone would be an option. But I would really recommend, and I recommend for all of my patients, that you stay away from all of the traditional sleep medications. And there's a good reason for that. Recently, there was a publication that showed that more than 18 doses per year of any sleep medication significantly increased your risk of death. And that study was very well performed, very statistically valid study, and really, for me, put the last nail in the coffin as far as what I recommend for my patients. Certainly, there are reports of people who are doing bizarre behaviors, going out and driving, or taking their kids up on the roof, and they don't have any memory of it because they're on sleep medications, but that's a pretty rare side effect. The more concerning one for me is this increased risk of death at more than 18 doses per year. So I've stopped recommending almost all of the traditional sleep medications for my patients, with the exception of melatonin. If you need a little bit of help regulating your cycle and you can't quite get rid of all the blue lights in your house, you can help take a dose at bedtime, kind of get your natural cycle going. Or then gabapentin is the one exception that seems to improve the stage 3 sleep and allow you to get the restful sleep you need.